I'm Dr. Hakkyu, board-certified dermatologist and head doctor at Root Hair Transplant Center. I'm going to explain to you some things about hair transplants today. Today's patient is in his late 40s and experiences hair loss. He has a very visible widow's peak. Let's look more closely at his case. If you look at the picture, his widow's peak goes up quite a lot on the sides and he has a wide forehead. I lowered his forehead hairline about 1.5 centimeters and filled in the widow's peak. We decided to transplant some hairs on the sides of his face as well, since his forehead appeared wider after we transplanted hairs along the upper hairline. This patient works as an accountant. We preferred FUE over FUT. After doing his own research, he came to the conclusion that he preferred FUE because he thought that it would be less visible after surgery. However, for FUT, we just have to shave the back of the head a little bit. So if you have medium to long hair, the area we harvest from at the back of the head can be covered. For FUE, we have to shave a large part of the back of the head. Since we have to shave off a lot more hair with FUE than with FUT, it is more visible after surgery. Of course, FUE surgery can also be done without having to shave any hair off, but is not very common. FUE surgery is much more effective when we shave the hair, so we choose the last method. After hearing this, the patient decided on FUT. We recommended a surgery called Max 5000. If you don't need to lower the hairline but only need to fill in a bit of the widow's peak, you can choose to do Max 4000. Even if he chose to only get 3000 hairs transplanted, it would have looked very good. However, since he has received a lot of stress about his forehead, he chose to lower his hairline by approximately 1.5 centimeters using 1000 hair follicles. That's why we recommended Max 5000 using the FUT method. This is a picture from 1 year after the procedure. We actually ended up using approximately 4200 follicles. If you look at the picture, you can see that the widow's peak has been nicely filled in, and his forehead now appears to be much smaller. He was very satisfied with the results. A lot of male patients experience a widow's peak and want to lower their hairline a little bit. Actually, most of the patients we see on a daily basis are very stressed about their hairline. This is why they wish to get their hairline transplanted even lower than recommended. I fully understand. There is always a part of us that is trying to overcompensate the stress we get from our hairline through surgery. However, we always inform our patients that a hairline which is too low looks really unnatural. It was the same case with this patient. We mutually decided to lower the hairline by 1.5 centimeters. However, he wanted to lower it more. Since we have about 4000 follicles to work with, we cannot lower it too much. It's because we have to focus on the widow's peak first, and the patient had a lot of areas that needed to transplant. So thankfully, our patient followed our plan, through which we could transplant 4200 hairs with the Max 5000 FUT surgery. The widow's peak was filled in well, and the forehead also looked very balanced. So today, we looked at the Max 5000 FUT surgery.